Hi, everybody. For this week's clinical conference, I saw a patient, AP, who was a 20-year-old female with a past medical history of potassium wasting nephropathy, SIBO, GERD, and PCOS, and she presented with some abdominal pain, decreased PO intake, and weight loss. She's been experiencing this abdominal pain for over a year, and she's been describing it as feeling like things aren't moving in her stomach. She's unable to identify anything that makes the abdominal comfort any better, but she says that eating and not getting enough PO intake for fluid also makes it worse. She's currently limiting her diet to scrambled eggs, spinach, toast, bananas, and potato chips, and she's been avoiding garlic as well as onions in fear of making her abdominal comfort worse. She is currently unable to tolerate more than 2 meals per day, and she's also unable to take in any supplemental drinks like nutrition drinks like Ensure because of her intolerance of milk proteins. Her decreased energy has made it very hard for her to perform ADL, such as showering, and also she has a port as well that is excess, and that also makes it difficult for her to shower. So when we went to see the patient, we did a full psychiatric evaluation, and she meets the DSM criteria for generalized anxiety. She also meets the DSM criteria for OCD. She's been endorsing symptoms such as excess hand washing and obsessing over having things in her room a particular way. She also is having panic attacks as well. And her panic attacks, she said that they were triggered by things such as the way that people treat her and seeing other people vomit. They last for an hour, and they manifest as increased heart rate and hyperventilation. So the patient, after we talked to her and after talking with the medical team, we are working her up for somatic symptom disorder because all of her tests have come back negative. She's had several endoscopies as well as colonoscopies, MRIs, and there's absolutely no structural reason for her to have such severe abdominal pain. In the past, she has had also several failed medication attempts or failed medication trials of Lexapro that was failed because of allergic reaction. Remeron caused her to be too sleepy in the Elavil. She did find that helpful, but she said that it caused constipation, so she wasn't able to tolerate that as well. So when we asked the patient if she wanted to treat her anxiety possibly with some medication, she refused because she said that she'd rather address her medical condition first before treating her anxiety because she believes that's what's causing her anxiety is her medical conditions. And we talked to her and her mother about the mind body connection. They were very against acknowledging the fact that our mental health and our body all play a part in each other, and that our mental health can manifest as physical symptoms, as we all know, like with stress and anxiety that can cause gastric ulcers. When we're afraid or worried about something, our heart can increase and cause tachycardia. And we tried to explain this to the patient, but she was very much against it. So for her diagnosis, XS1 is severe generalized anxiety and possibly some somatic disorder symptoms or disorder, somatic symptom disorder. XS2 is deferred. XS3 is potassium wasting nephropathy, SIBO, GERD, and PCOS. XS4 is the inability to attend school due to her mental and physical illnesses. And XS5 is 40. So I found a really good article that talks about somatic symptom disorder and functional neurological disorder. And it says that there are a lot of maneuvers that neurologists can utilize to establish that the patient's symptoms are not attributed to a structural cause. And those would be things like such as checking reflexes, specifically Babinski reflexes, and other structural um, features in our actual extremities or whatever the case may be for that patient's presentation. And also in psychogenic non-epileptic seizures, we can hook patients up to EEG to make sure that there's no um, epileptic activity to rule out whether they are true seizures or not. And in this patient's case, they've worked her up for so many GI issues, but they have not been able to find any structural problems with what's causing her symptoms. All right. Let me know if you have any questions.